let's get on with the details now. School authorities at the St. Martin Senior High School in Nsawam in the Eastern Region say media reports on the supposed collapse of over 20 students of the school at the weekend is an exaggeration, while reports in the early hours today didn't give details on what may have triggered the collapse of the student, but said they were being attended to at the Nsawam Government Hospital. Senior Housemaster for St. Martin Senior High School, Dominic Enchi, joins me now live on the line with some more details so we can understand exactly what we're dealing with here. Mr. Enchi, thank you very much for your time here on the Pulse. Now, what is your what is the school saying? Are you saying that 20 students collapsed or not?
What happened was the whole incident took place yesterday in the night around 11:30 to 12, when we had a message that some of the students are sick. So we went to the school gate and we asked the taxi drivers to send the students to the hospital. And when we sent them to the hospital, the doctors attended to them and they said some are suffering from malaria and asthma because of the change of weather. So they were taken care of and brought back to the school yesterday.
20 of them?
Pardon? They
20?
Are up to 20.
How many?
Those that we sent to the hospital yesterday were about 8.
Okay. And then
so
this morning, something else happened.
This morning we were at Assamel when a girl, which we took her to the hospital yesterday, collapsed at Assamel. So we asked the school nurse to send her to the hospital, the school
clinic. Okay.
Student nurse to send her to the hospital. The girl was sent to the hospital and she was admitted. Then another time to some of the students also collapsed. We took them to the hospital.
Okay.
And the Reverend Father went to the hospital and brought many of them. So at the moment, we have one of our teachers at the hospital taking care of the rest, and information gathered now indicates that those that they have admitted is 2. Information gathered indicate that there were 7 girls and 5 boys at the hospital, but they've discharged all of them. It has remained a boy and 2 girls. So the students, the number of students that were sent to that place, they are not up to 20 as has been exaggerated.
So yesterday you had 8, and then this morning you had how many? 4?
This morning we took about 7 girls, 7 boys, and 7 girls and 5 boys.
Well, 7 girls and 5 boys.
Yes.
So that's what happened this morning alone.
Hello, I'm listening.
Okay, so that's happened this morning alone.
Yes, this morning.
Okay, so that makes 12. So that plus 8 of yesterday, that's actually more than 20.
That's what I'm saying, that, madam. That's what I'm saying, that those that went yesterday, we brought some, and some of them were still complaining.
Okay.
Okay. So that is what happened.
So we can settle on the number now. I mean, we can say from the figures you've given me that more than 20 people were...
That's what I'm saying, that yesterday,
okay, so hold on. I understand. So hold on. Let me just summarize it. Okay, so from what you have told us right now, you have more than 20 who were taken to the hospital between yesterday and today. You say that only one person collapsed this morning. Is that correct?
Yes, one person. One person.
Only one person.
We took her yesterday, and this morning too, she collapsed. So as for her, she's now being attended to.
Okay. Is this a normal thing? That's a lot of students getting sick.
When we are experiencing change of weather, especially the asthmatic patients, and this was normally taking place at Form 1. No, they have come.
They are fresh.
And they are not used to the weather condition.
Okay.
Because so far, those that we send, the seniors are few, like the 7 girls.
7 girls, 5 boys. Yeah.
Yes, the seniors are 3. That is two 2 girls and 1 boy. The rest are in Form 1.
Okay.
So it is something that normally takes place in school. Students becoming sick and arrest. And when they are sent to the hospital, they are attended and discharged. And also, we are going to write examination. I know that the Form 1 students, they've not written this examination before. So they were panicking. That's also, it's not any serious thing which are
okay.
taking place.
So hold on, sir. And I think that you will appreciate why everybody is concerned about what is happening at St.
Yes,
Martin's.
I do.
Because
I do.
if you hold on for me, sir, it's because of what has happened in Kumasi Academy and how authorities they handled it until 4 people died.
Yes,
Another has happened at Koforidua Sec where they're testing students for meningitis. So obviously we are concerned, and the parents of the students you have are concerned. Now we need you to be very honest, sir, and give us the details. What are the symptoms? What is it that they are complaining of? Apart from the
malaria, asthma, and the rest. You can call at the Nsam Government Hospital and find out from the doctor there, the one who attended to the students.
Okay, so those who were taken to the hospital were diagnosed. No, so those who were taken to the hospital were diagnosed with malaria and asthma, and some are asthmatic.
Most of them were asthmatic patients.
Okay, so apart from those who were asthmatic and those who had malaria and the one that collapsed, we're also hearing that you some of your authorities or some of the authorities at the hospital are saying it is as a result of hysteria, that they are about to write exams. There's a build up of anxiety, etc. What do you say about that? Is that correct?
That, because of the examination, so some of them were panicking.
And so what I wanted you to establish for us as well, say, is whether or not you are seeing something that you usually see. Is this normal, or is this something that has happened, you know?
As for student sickness in the boarding house, it is something that do happen.
But at this, with this number, is it at this rate? Is it the same? Like you have about 20 people being sick at the same time?
That more than these students were sick, and we took them to hospital. It's as for student sickness, it's normal. We are all human beings. So there's likelihood that we can become sick.
Okay. Have you been in touch with the parents?
Pardon?
Have you been in touch with their parents, the parents of these students?
Yes, even some came to the school today and we told them, some came. Even now, some of the parents came and even some came thinking that maybe their children are involved. We went and called their children for them and nobody was affected. After that, even there is a girl that the parents went to the hospital and took her to the house that is going to take her small before the girl will come to school.
What is the mood at the moment among the students? Are they panicking?
Oh no, we called them and spoke to them. Even the Reverend Father called all the girls and spoke to them. So now they are okay. They are okay.
They're okay.
Do you have? We spoke a lot to them and asked them not to be panicked, because initially they were also panicking because of what happened at Kumasi Academy. But we have been able to counsel them.
Is
so
the
situation is under control.
So you say it's under control.
Yes,
are you putting in place any modes of surveillance in Koforidua Sec, for example? They're monitoring the situation closely. About 20 of them, they've taken them.
We are also monitoring it very, very closely.
How are you doing that, sir?
Because we have told all housemasters and housemistress to be on alert. If anything, they should inform us. So we are monitoring the situation because of what happened at various schools. We don't want anything of that to happen.
Are you doing this on your own as school authorities, or you're involving the Regional Health Directorate?
Yes, we are involving the, even just recently, just this morning, NASBO came and they came to study the situation, and the District Health Director also came. So it is the District Health that will inform the Regional Health.
Okay. All right, sir. So you're telling the parents of your students to be...
The medical officer is aware of the situation.
Okay. Okay. But then you're giving the parents of those students that you have the assurance at this moment that their children are safe.
Yes. Yes, the children are 100% safe.
Okay, so we'll say a very big thanks to you. We'll get back to you as and when we have to and when there's any new development. Dominic Enchi is Senior Housemaster, St. Martin's Secondary School, Senior High School in Nsawam. Let's stay a bit longer with the health of students in senior high schools. Now, 20 students of the Koforidua Secondary Technical School in the Eastern region are also under strict monitoring by health officials after one person died there from what health authorities have confirmed as meningitis. The student is said to have died last Friday after complaining of fever and bodily pains. JoyNews understands that health officials have begun rolling out measures to avoid a spread of the disease. Let's get on the line now and speak to our Eastern Regional correspondent, Kofi Sia. Kofi, first of all, describe to us what we ought to know about the incident involving the student who died last Friday.
Well, the incident, just as you said, happened last Friday. This boy, a second-year student of the school, he's 15 years, complained of headache, a severe headache. He also complained of feverish conditions and chilly body. So the housemaster attended to him and rushed him to the Koforidua Regional Hospital, where he died, where he was pronounced dead by the health authorities there. So they took samples of his fluid and blood and conducted a laboratory test on it, and it proved to be meningitis. So that is the situation from last Thursday night till today.
Well, we can hear from the Eastern Regional Director, Eastern Regional Health Director, Dr. Charity Sapon. But Kofi, hold on for us whilst we listen to her, and then we'll talk about the other things that have happened.
That's on Thursday. We got information about a case from Sec that had been sent to the regional hospital, and I think they were suspecting meningitis. The doctor in charge who received the case took all the necessary investigations, including a lumbar puncture, and necessary investigations were carried out, whilst the 15-year-old boy was also, treated, put on treatment. I must say, yes, he passed off the following day in the early hours of the morning, that is on the 8th. He was admitted late on the 7th and passed on the 8th. But then the results that came out showed that, yes, it was positive for meningitis. So immediately the Regional Health Directorate as well as the New Jabe District Health Directorate were all informed, and a team was immediately dispatched to the school. In the school, they met the assistant headmaster and some teachers as well as students, and to repeat that it's not an outbreak of meningitis. Yes, it is positive and a case of meningitis, which it has been treated the way it should be. But then this doesn't mean it's an outbreak. I must say that throughout the year, occasionally there are cases of meningitis which we treat. Yes, and I must say majority of them, are healed and recover. It's very unfortunate that our young boy couldn't make it, but then we've put in all the necessary things to ensure that such a thing doesn't happen again. The school is also being supported to revamp its infirmary, because it's one of the things that we noticed, that they needed to revamp it to make it very active, so that any student that gets the slightest ailment will be referred to the infirmary, and where it's necessary will then be referred to the hospital in very good time, so that we can be able to ensure that the necessary treatment is given. Again, we are all on alert, and we are intensifying surveillance. We are liaising up with the Ghana Education Service at the regional level to see how best, together as a team, we can look at the schools and strengthen or build the infirmaries around, equip each one with the basic symptoms of especially diseases of public health importance, so that at least we'll be able to catch them early enough to ensure high survival rates. Thank you.
Okay.
Droplet infections or airborne infections. And we have different types of meningitis. Some can be caused by various microorganisms, some of them bacteria, we have viral, we also have chemical meningitis. There are different causes of meningitis, and most of them is through airborne, and coming into contact with the infected droplets. And basically the cardinal signs and symptoms that we want to look out for in such cases include fever. That is, the person feels hot. When we talk about fever, the person feels hot, and there are sometimes chills, and either the person is sneezing, coughing, sore throat, and then there is also a neck pain in the neck. Sometimes in the severe time they even get very stiff neck, and they come in with very stiff neck, otherwise they complain of pains in the neck. Now, these symptoms do not occur only in diseases of meningitis. So when they come, you don't immediately make a diagnosis of meningitis because they mimic so many other infections that we have to handle. So when they come, the appropriate investigations are done. One of the most cardinal ones in the case of meningitis is a lumbar puncture. And this lumbar puncture is then sent to the laboratory. It is investigated to see the causative organism in it, and also to confirm whether it is a suspected case of meningitis or not. And once we catch them early, I must say there are appropriate treatment that it's available, and which they respond quite well to it.
Well, you just heard Dr. Charity Sapon. She's Eastern Regional Health Director there, explaining the symptoms and what really doctors can do about it and what they are doing about it in that region. Kofi Sian is still on the line. Kofi, what are the authorities at the school saying about the situation?
Well, as we speak now, the headmaster or any official of the school hasn't been able to, comment on the issue now. But what I have gathered so far from the school is that the school authorities, in collaboration with the Regional Health Directorate, have been able to embark on a cleanup exercise in almost all the dormitories in the school to ensure that the disease does not spread to other students. So this is what they have been doing. The doctor also says that they are also working closely with the school to ensure that any reported cases of meningitis or any suspected cases of meningitis would be addressed as early as possible.
What about the students? Did you get the chance to interact with them? What's the feel?
As at the time the guy was reported to the hospital, most of them were not aware he has been hospitalized until yesterday, when news broke out that the student had died. So some of them got to know about it over the weekend. And as I speak with you, they are going about their duties normally. They are in class studying. You wouldn't see any sign of of students who are scared or something like that.
In Kumasi, and this will probably be my final question, unless there's a follow-up, but in Kumasi, we saw a lot of the parents trooping into the school to take away their children. Are we seeing something similar in
When I got to Koforidua Sec, the situation isn't like the one you reported in Kumasi.
Right.
In Koforidua, I didn't see any parent there who had come to see the child. So I'm sure maybe they've had enough information from the school authorities that it isn't that dangerous. So they are not there. When I got there, I didn't see any parent there.
But for the parent of the deceased, what's What are they saying? I mean, this
Well,
must obviously be...
I haven't got the opportunity to speak to the parents. The parents currently, as I'm told, are in Accra.
Okay. All right. Kofi, thank you very much for that update. Kofi Siao is our Eastern Regional Correspondent. Now, let's still stay on this matter. We're still in the school looking at what's happening with the wave of diseases that's killing children in schools. Now, bereaved families of the 4 students who died at the Kumasi Academy from swine flu are meanwhile disputing the autopsy reports presented by health officials. The parents say they have different reports showing different results. Love FM Sohim Interior has been speaking to the family of the deceased student and sent in this.
Because Accra on Yari. Accra no be fie adwada. Oba na mowa edo atwa ne mama so.
We are extremely angry. What are the authorities trying to tell us? We are confused. My child came home and looked very healthy. We were only told he had died when he returned to school. My child didn't look dead when I saw the lifeless body. Why didn't they tell us he was unwell?
Something. I know around 3 something. Take. Parents nyanya we mo frɛ ba na so. Mo frɛ ba na owu. Enti me cost na me bra na yere court kwaje order yi. Ana me come watch ho.
Enti me call ye no. Na teacher ni busa mama ne na me bo amane. Enti bo amane no so maintenance na. Doctor wo hwe akwala na nti. Maintenance na e kakra. Enti me betena ase.
One of the teachers called me to say my child was unwell. I came to the school and had to wait for the teachers to tell me why they wanted to see me. They kept asking me questions about my son.
Some parents there obviously unhappy, understandably so. Meanwhile, officials of the Ghana Health Service are currently taking individual samples from the student of the Kumasi Academy as a way of containing the situation and avoiding further spread of the H1N1 strain. In the wake of these cases, if you're unsure what to do to stay safe, here's a little advice that we've sourced from the WHO for you, as we did the other time, and I'm going to go through those quickly. Well, obviously, there are many steps that you can take. Practice good hygiene, frequent hand washing. You fortify your immune system with healthy foods such as fruits and vegetables, and avoid close contact with people who are sick with a contagious infection from bacteria. Just because you're not sure, anything that looks suspicious, something that you want to stay away from. Also, what more can you do? You can take antibiotics when needed. Avoid developing resistance to antibiotics in the future. The thing is that if you keep taking antibiotics, there's a tendency that your body develops, or the bacteria that works in the system develops resistance and are able to fight the antibiotics. So you only take the antibiotics when it is needed. And certain viruses and bacteria are transmitted through close contact between people, that I have said already, and several situations increase such contacts, including the following: living or working with other people, sharing items, giving care to a person, and frequenting public areas. And of course, we know that here in Ghana, there are a lot more situations that we face, like lack of toilets in homes, so you have to use the public toilet, etc. These are areas that you ought to be very careful of. Talk also about the measures that you need to take in order to prevent the transmission of the viruses and the bacteria. Here are some details. So first, you can get vaccinated, like what's been done for the student of Kumaka. They were given some antibiotics, we understand, because vaccination is the best way to protect yourself and others. And when a vaccine against an infection or disease is available, what you need to do is go for it, get it. Now, you need to apply recognized hygiene measures. And that, for example, You're always keeping your hands clean, like I indicated earlier. Keep washing your hands with soap. Follow tips and techniques for washing hands, because there is a way actually that you can wash your hand that's more effective than perhaps the normal ways. Now, you follow tips for coughing and sneezing without contaminating, and you do know that you need to cover your mouth. You need to be sure that you stay away from other people just so you don't spread any bacteria. Avoid touching your nose, your eyes and your mouth, because these are entry points for viruses and bacteria. So as much as possible, avoid doing that. And if you are in the habit of biting your fingers, obviously this is one of the moments that you don't want to continue doing that. Avoid contact with people who are sick, because whatever sickness they may have may be contagious, and do not get close to them. Do not touch objects that they have used, like their utensils, for example. Another thing that we need to do, irrespective of whether or not there is an outbreak, is to clean your surroundings regularly, as well as the sanitary appliances that you use. For example, clean your counters and other surfaces that you touch often with your hands. Also, wash toilets and sinks in order to keep them clean. Cleaning has proven, of course, to be a very effective way in killing viruses which can survive on hard surfaces. So cleaning is a very great option, and you have to clean with soap, water, or any domestic detergent. All right, and let's get a very quick update as well. The homicide team from Accra has been dispatched to join the regional police command in the northern region to protect lives and properties in the violence that has erupted in Bunkurugu. This is according to the Northern Regional Police Command. 4 people have been killed and 8 wounded at Najong number 1 in the Bunkurugu Yoyo district of the northern region following a shooting incident there. Joining us on the phone now is our Northern Regional correspondent, Martina Bugri. Hello, Martina.
Hi, Gifty.
Martina, has the police or the homicide unit arrived yet?
As of the time, I'm unable to tell, but as of the time we spoke, we were addressed this morning by the regional police commander. They said they had set off and they are expected in the region today to help the team here begin investigations.
Okay. Do we know what time they are to arrive?
That he's unable to tell.
Okay.
But they are expected in the region today. That's what we gathered.
Very well. We also understand that there have been some arrests. Give us some details.
Yes, there was an arrest last night in Bimbila of 3 people who were found with one single barrel gun in the area. And you know, Bimbila is under state of emergency. People are not supposed to possess those firearms. And so the 3 were put: Isa Amadou, 26, Mohammed Seydi, 23, and Isa Sani, 25. They have been charged with possessing firearms and also outside safety hours. And so these are the charges they are preparing against them.
Do residents feel secure and safe enough in the midst of all of these?
I've been speaking to people in the region, and people are a bit worried that in just 3 days they have had incidents of firing, arrests in connection with ammunition. They are worried that the region is eventually becoming a haven for people who possess arms and deal in arms.
At the moment, how are the police there containing the situation?
Addressing the media this morning, the regional police commander said their surveillance and up to the fact is the reason why they are making these arrests. And he assured the residents that they should be calm. The police is on top of the issue, and they would bring all these people to book.
Very well. We look forward to that. Martina, thank you very much. We'll come back to you as soon as the team arrives so we can know what they're up to there. Martina Bugri is our Northern Regional correspondent there. Well, News Desk earlier spoke with the Assembly member for Bunkurugu Yoyo, Zongo actually, Yaro Mohammed, who narrated the incident.
Yesterday around 6 p.m. Yesterday was Najong number 1 market day. So when they were about to close the market around 6, unidentified gunmen came and occupy there are 3 roads there, one leading to Inyo side, and the other one goes to Nakwanduri, and then the last one goes to Bunkurugu. So they stood there, and then the one from the Inyo side opened fire. Then shot some 2 people dead there. Some 2 people, and then they took them. It even happened. Those at the Inyo road opened fire, and then those in the Bunkurugu road to open fire, and then those at the Lindsay roadside also opened fire. So people were running, scattered for their lives. So after they finished, and I saw the 2 people, they were using 3 motorbikes. So in all, there were 6 people. So 4 of them took the Nakwanduri road, and then the other person also took the Yinyo road. So after they left, the community members came around and then there were 13 people who had injured. So when they sent them to the Bindi hospital, 4 of them were confirmed dead. And then they took the rest of the 9 to Baptist Medical Center at Nalego.
Right. Honorable, why were they opening fire on each other in the first place?
For now, we don't know why they came and opened fire like that. And the community, they don't have any quarrel or any conflict with any person.
And but this was between 3 separate factions.
Sorry?
From what you're telling us, this was between 3 separate factions.
Yes.
You heard the one of the community leaders, actually the assembly member in Zongo, speaking to Daniel Dazi. You're still watching the polls. I'm going to take a very quick break. When we return, we'll still bring you some more stories. And like we indicated, Christmas is approaching, and we're putting the spotlight on food safety. We'll be bringing you some tips on how to stay safe from fake, contaminated, expired food, and those tips are coming from the Food and Drugs Authority. Please stay with us.